So a healing conversation includes validation. Ultimately, for me, I think it's very important that people like you and me communicate to DACA recipients, you are not alone. We support you.
Yeah.
I am here for you. Let's work together.
Hi, this is Ike Evans of the Hogg Foundation for Mental Health, and you're listening to Into the Fold. The Hogg Foundation is a strategic grant maker based at the University of Texas at Austin. To learn more, visit us at hogg.utexas.edu. Here in Texas, about 124,000 people are recipients of Deferred Action for Childhood Arrivals, or DACA. These young people, many of whom are now enrolled in our state's colleges and universities, were brought to this country as undocumented children and, through the program, granted work permits and a reprieve from deportation. Meanwhile, thousands of college students, including a large number right here at UT Austin, are now struggling with anxiety and uncertainty about what the future might hold. DACA is now in limbo, its fate being decided in Congress and the courts. Our guest today is Sebastian Colon Otero, a licensed clinical social worker and a therapist at the Counseling and Mental Health Center at the University of Texas. He's here to share insights on what these students are going through and what campus communities can do to support them. Sebastian, thank you so much for joining us.
You're welcome. Thank you for having me here.
Okay, so from your standpoint as a therapist, what message do you think DACA students should be getting from their university?
I think the most important message that they should be receiving is that they are valuable.
Yeah.
They are important part of our institution. They're important part of our society, and that they're valued.
Yeah.
I think also when we say to the message of being of value should be like together with resources, and to show that we appreciate their presence, then to offer support and resources, which is part of what I do, is try to offer support.
Right. And it seems that with this issue, you can almost track people's anxiety levels, almost as if it were an oscilloscope. Every time that there's a newsworthy development where DACA is concerned, what are some of the major themes that you're able to detect in the conversations that you're having with DACA students?
Well, Ike, as you will say, there is an anxiety. And sometimes in society, we use anxiety as a general term for feeling stressed or worried. And here we're talking about a serious impact.
Yeah.
We're talking about potentially trauma. We're talking about acute stress reaction, which is a immediate reaction to trauma or threat of life. People who are under DACA, people who are recipients of DACA, since the initial experience last year with the change in the policy and the end of the program, my experience with students is a lot of them are experiencing acute stress reaction, including difficulty sleeping, difficulty functioning, feeling concerned and hyperreactive when they walk down the street, feeling unable to function, having a level of anxiety that affects their capacity to function in everyday life.
Yeah.
And we're also talking about PTSD for some students are experiencing traumatic reaction around with all the symptoms by the book in terms of hyperarousal, anxiety, lack of energy, symptoms of depression, nightmares, feeling uncertainty about the future, create sometimes these imaginary stories, what's going to happen, planning in their minds what plan A, plan B, plan C, depending on the circumstances. We're talking about a serious impact in the mental health of the students. And I want to clarify that this is not only for DACA recipients, who are the main character here, right? The main people being impacted by the current conditions, but also their friends, their families, their peers, the faculty members, staff members. This is a ripple effect in society.
So, I mean, it seems to be a recurring, I don't know if theme is the right word, how it is that we cope with these externally induced shocks. And given the fact that you are not a policymaker and there's only so much reassurance that you can give to a student, within those constraints, how is a healing conversation possible?
So for me, the word a healing conversation, it's, well, yes, it could be healing, but how far can we heal if we don't heal the legal condition? First, I think it's important to acknowledge that this experience is real and that the reaction that the student is having, it's real, it's normal, it's within the realm of a reaction to a trauma. So to offer support around validation, what's going on is hard, it's real, instead of minimizing or trying to immediately go into some kind of grounding technique or breathing exercise without first validating that this is very real and that there is this external context that is having an impact. And second, to work together to explore how to increase within the limitations. We cannot change the policy. Within the limitations, how can we increase a sense of safety? So can we create safety plans? Can we create emergency plans? And can we explore what are the options depending on the different outcomes to create a sense of, at least I would know what to do depending on what happens. To also work with the current sense of safety. If there are resources or if there is any kind of accommodations that can be made through professors, if there is a particular class that is highly triggering, is there anything we can do to help the student manage that space?
Okay.
Is there anything the faculty member can do to help the student? Ultimately, for me, I think it's very important that people like you and me communicate to DACA recipients, you are not alone. We support you.
Yeah.
I am here for you. Let's work together.
Right. If you can imagine the kind of person who is highly skeptical of the very idea that we should be any more welcoming to a class of young people, whose parents violated federal immigration policies, and so are most inclined to doubt, and not just the specifics of what it is that you're saying, but also the entire framework in which you're saying it. What do you think the two most important takeaways are from your work with DACA students?
Well, one thing I have learned, working with DACA students, is the incredible value that they bring to our university and our society.
Uh-huh.
And many times we talk, even here, when we talk about the impact in their mental health, it's almost like we're talking about caring or protecting someone. And I invite policymakers and Congress people and folks who have some kind of disagreement around supporting and protecting DACA to think about the cost that not protecting DACA recipients has for our society. Now, to the question of what I would say to people who are not open or maybe more resistant to the idea of welcoming DACA students and making them full participants, the cost of not having them is on us. Every DACA person that I have met is highly invested and connected to their community here. It's the only community that they know. So what I would like to say is that sometimes we talk about this in almost like a theoretical, detached way, without understanding that these are people who have an active participation, in this case in the universities and colleges,
Yeah.
and that it is our loss not to include them.
Okay, so we are talking about DACA students, how we can support them, and how we can better understand the world if we can adopt some of their standpoint, I would think.
Absolutely.
Sebastian Colon Otero, thank you so much for finding the time to talk to us. We really appreciate it, and we appreciate you. Thanks.
Thank you, and thank you for taking into consideration these important issues.